Hi everybody. Today we're gonna examine the nose, and so we're gonna look at the external part of the nose, and then we're gonna go in and examine the internal part of the nose. As you know, nose is the primary respiratory organ. Okay, and besides respiration, one of the other important functions of the nose is the olfaction, which is what we call as the smell organ. So these are the two most important organs, functions of this organ. And so during respiration, so there are additional aspects of respiration. So the inhaled air, as it goes through the nose, it passes through the nasal cavity, and this basically allows the air to be warmed, humidified, and filtered. So, in addition to respiration, there's also accessory functions of the nose, which I will talk about a bit later. And one of the air basically goes through what we call the opening of the nose, which is the external nasal opening, which is the nares or the nostrils. Let's look at the external part of the nose here. So first we see the skin here. So with we have the root of the nose. It starts where the nasal bones meet the frontal bone, and this area is also called the bridge. So the root of the nose, or radix nasi. We have the dorsum of the nose, dorsum nasi, and then we have the apex, which is basically located at the tip of the nose, the apex. And on either side we see the wings, which we call the alar of the nose. And then it's covered by the skin. Okay, and so the external nose is basically composed of bony component and cartilaginous component. So we're going to look at these bones and cartilages one by one. In between, so the bony component is at the upper part. It fills and forms the upper part of the external nose, and the cartilaginous component forms the lower part of the nose. And the skin of that attaches to these parts, especially where it attaches the cartilaginous or cartilages, it's really firm, and it really attaches to the cartilage really firmly. However, at the upper part, if you look at it, if you move your skin at the upper part, it attaches loosely to the bony component. Okay, so let's look at the cartilaginous and the bony components of the nose. Let's look at this model here. So what we see here, we see at the top, we see the frontal part of frontal process of the nasal process, so nasal part of the frontal bone. So this is the frontal bone. So it forms part of the root of the nose, this area. And then we have two nasal bones on either side. Okay, and then we have here is the nasal process of the maxilla here. Frontal process of maxilla. This is the frontal process of maxilla. Okay, and in the maxilla we see a depression, and this is basically called the notch, the nasal notch of the maxilla, or incisura nasalis. And most anteriorly, both right and left, the edges of the maxilla come together, they form the anterior nasal spine. So these are the parts that make up the boundaries between the cartilaginous and the bony component. And also this area, so basically after death, so you don't see the cartilage, the soft tissue, we only see the borders of the bones. And this area is called the piriform aperture, apertura piriformis. So this area is basically filled by the soft tissue, which is primarily composed of the cartilages. Okay, so these are the bony component. Now let's look at and examine the cartilaginous component of the lower part of the external nose. Okay, so we're basically looking at this model here. As you can see the lower part of the nose. If you look at this angle here, so this upper part, this area is the nasal bone, and we have the nasal process of the frontal bone here. Okay, so this upper part of the external nose is bony, and the lower part is cartilage, like I said. So which cartilage do we see here? On the dorsum and lateral part of the nose is formed by the lateral cartilage. This is the lateral cartilage here. And this one here is the alar cartilage. Okay, and alar cartilage basically is located in the alar of the nose. And behind the alar cartilage, as you can see here, there's small couple of tiny little bones there. They're also referred to as sesamoid or accessory bones. They're really small. There could be 1 or 2 or 3 in number. And the alar cartilage divides into two parts. We have the medial crus and lateral crus. Excuse me. The lateral crus, as you can see, it's part of the alar, the lateral crus, and the medial crus here on the medial side, it's basically attached to the septum. Okay, so this is the medial crus. This is the medial crus of the major alar cartilage. Okay, and this is the lateral crus that is part of the major alar cartilage. And these cruri basically forms the outlines of the opening, the external nasal aperture opening, or nostrils or nares. Okay, and also the posterior part of this wing, of the nose, is formed by this fibrofatty tissue here. So most posteriorly, it's flexible, and basically this forms the contour of the nostrils on the posterior aspect, the fibrofatty tissue at the back. Okay, so these are the major cartilage that we see in the external nose. And then we also have a septal cartilage, which makes up the septum, which I will show you that when we get to the internal nasal cavity, or internal areas or parts of the nose. So we looked at the bony component, looked at the cartilaginous component, and now let's look at the muscles here that is part of the nose. The first muscle that we see here is the procerus muscle, as you can see here. It starts from the nasal bone and it goes and attaches to what we call the area, what we call as the glabella, in between the eyebrows here. Okay, so when it pulls, it forms the horizontal wrinkles just like in frowning. That's procerus muscle. The other muscle that we see here is this muscle here, and this muscle is called levator labii superioris aliquinasi. Levator labii superioris aliquinasi has 2 slips, medial lateral slip. The lateral slip goes and attaches to the upper lip, so it pulls the upper lip upwards. The medial slip, it attaches to the major alar cartilage, or the alar of the nose, and it pulls the lateral aspect of the alar of the nose, and it basically dilates. It dilates and opens the nostrils, and therefore more air gets inside the nasal cavity. That's the second muscle. The third muscle we have here on either side, this is the nasalis muscle. Nasalis muscle basically is composed of 2 components, the transverse part, and then we have the alar part. The transverse part is also called compressor nasi, and the alar part is also referred to as a dilator nasi. So basically, the compressor nasi, or the compressor nasi part of the nasalis muscle on both sides, when they contract, okay, they will constrict. That's why they call it compressor. They will constrict and act like a sphincter, and they would basically decrease the diameter of the nasal cavity, therefore inhibiting or not allowing air to go inside through the nostrils. So this is the transfer part, or compressor part, or compressionasi of the nasalis muscle. The other is the alaris muscle. Alaris muscle is the muscle that pulls the lateral part of the major alar cartilage, and basically they dilate. Okay, they dilate the nostrils or the nasal cavity, allowing more air to enter through the nostrils. And the third muscle over here is this depressor septi nasi. Over here, little tiny little muscle. Okay, so these are the four muscles that was important associated with the nose. And let's look at the neurovascular supply. Let's look at the neurovascular supply of the nose. Okay, let's look at first. Okay, let me put it like this. Okay, first we have. Okay, so we have these yellow structures, which is the nerves that innervates the external part of the nose, and these are. Okay, so this nerve. So basically, we have two nerves that innervates the skin, which receives touch, pain, temperature, sensation from the skin of the external nose. There's actually two. There's actually three nerves. Okay. This is infratrochlear nerve. Okay, we have the infratrochlear nerve, and then we have the external nasal. Okay, external nasal nerve. Infratrochlear is a branch from the nasociliary or from the ophthalmic, from the nasociliary. And then we have the external nasal is a branch of anterior-ethmoidal, and that is also a branch of ophthalmic branch. External nasal, we don't see it here, by the way. Okay, this guy here is basically the infratrochlear. So we have infratrochlear, external nasal, we don't see. And the third nerve is the infraorbital. Infraorbital is a branch of maxillary nerve. So maxillary nerve gives off branches, nasal branches, and then basically it supplies the alar part, the apex of the nose, and a very small amount of the dorsum. And most of the dorsum of the nose is supplied by the infratrochlear and external nasal. And then we have the supratrochlear. Supratrochlear is basically over here. Supratrochlear is not the primary supply. So these are the three major suppliers of the external nose. However, we also have supratrochlear nerve. Supratrochlear nerve is also a branch of the ophthalmic, but this supplies the forehead. But however, it gives off branches that supply the root, very small amount, the root of the nose. But these are the three main suppliers that supply the external nose: infratrochlear, external nasal, and infraorbital. So those are the three primary nerves. Okay, now let's look at the arterial supply. So this is as you can see, this is the angular artery. An angular artery gives off here lateral nasal. This is lateral nasal. And then we have the dorsal nasal. Dorsal nasal, another branch from ophthalmic too. Ophthalmic, dorsal nasal, lateral nasal. This is angular. Also, we have the septal branch of superior labial. So the angular is a branch off from facial. This is facial artery here. Facial artery at this level here, it gives off superior labial and inferior labial. Superior labial gives off septal branch. So we have the septal branch that comes off from superior labial. We have the lateral nasal that comes off from the angular, and then we have the dorsal nasal that comes off from the terminal branch of ophthalmic artery. Okay, so these are the arterial supply of the external nose. Let's look at the venous supply now. The venous supply is primarily the venous blood is primarily received by the angular vein. This is the angular vein here. Okay, so angular vein goes down, so it receives these nasal branches from the nose, the dorsum, the apex, and ala, and they basically drain into the angular vein. Now, in this area, it will go either direction. It might go down, it might go up, because the veins in the face does not have any valves, so it might go in either direction. If it goes down, the angular vein would drain into the facial vein. It's the facial vein here, okay, along with the facial artery. here, and this facial vein would unite. At this level, as you can see, so there's retromandibular vein. If you can remember, retromandibular vein that comes from inside the parotid gland, it gives off two divisions: anterior division, posterior division. You see, anterior division would unite with the facial vein, and they would form common facial. And this is the common facial over here, very small, and common facial would drain into the internal carotid. Internal jugular. And internal jugular, as you can see, it's beneath, medial, and beneath this sternocleidomastoid muscle. This is internal jugular. So ultimately, the venous blood of the nose will go to the angular vein, to the facial, common facial, and would drain into the internal jugular vein. This is the posterior branch of the retromandibular, by the way, and posterior branch would unite with the posterior auriculus. The posterior auriculars scanning along or on top of the sternocleidomastoid. So the posterior division of the retromandibular and posterior auricular would unite, and they would form external jugular. And external jugular, as you can see, runs obliquely on the superior surface of the sternocleidomastoid, while the internal jugular is beneath the sternocleidomastoid, medially beneath the sternocleidomastoid muscle. Now this area is also referred to as the danger triangle of the face, this triangular area. Why? So like I said, so the venous blood that goes down, it would drain into the internal jugular. However, some of the blood, sometimes the blood would go up and would drain into the ophthalmics. We have superior inferior ophthalmic, and superior inferior ophthalmic in the head area, it goes into the cranium, and superior inferior ophthalmic vein, they would drain into the cavernous sinus. What's the importance of cavernous sinus? So this is the cavernous sinus here. This is inside the base of the cranium. So do this. This is the base of the cranium. Okay, so basically this is the cavernous sinus here, and so the importance of this is that the wall of the cavernous sinus could contain important cranial nerves and important blood vessel, like third cranial nerve, fourth cranial nerve, sixth cranial nerve, V1 and V2, which is the maxillary and mandibular nerve, and then we have the internal carotid artery. These basically form the wall. Sixth and internal carotid is it's not at the wall but medial to it, but anyhow, so these structures are located inside the cavernous sinus. So the importance of this is that so why do we call this the danger triangle of the face? So if you have an infection in this area, the blood will carry this. If it carries down, it will go to the system, no problem. It will be eliminated somehow there. But if it goes up through the superior inferior ophthalmic, it goes to the cavernous sinus, and from the cavernous sinus, it would affect the cranial nerves. It will affect the cranial nerves, and it will affect the internal carotid artery, and that's why this area is referred to as the danger triangle of the face. Okay, so that's the neurovascular supply. Okay, so that's about it for the external nose. So let's look at the internal nose now, or the nasal cavity at the wall of the internal nose. Okay, so okay, now we finished the external nose. Let's look at the structures that are present inside the nose, which is the internal nose, and how they are organized. Okay, so as you can see, these are the nostril nares, the two openings at the front where the air goes through, and then it basically goes backwards to the nasal cavity. And these nasal cavities, there are two of them, one on the right, one on the left, and these nasal cavities divided by what we call a septum. So the septum, as you can see here, divides the nasal cavity into two halves, one on the right and one on the left. All right. So let's look at it in this model here. So this is the nasal septum, and this is the a section, or sagittal section, that went through the mid part of the nose, and we see the nasal septum here. Now, the nasal septum, as you can see, it's formed by cartilage and bone, just like the external part of the nose. The anterior 1/3 of the nasal septum, it's formed by the septal cartilage, and the posterior 2/3 is formed by the bony component. So posterior inferior, it's formed by vomer. This is the vomer here, and posterior superior bone is formed by the perpendicular plate of ethmoid. So we have perpendicular plate of ethmoid, vomer, and septal cartilage. They come together and they form what we call as the nasal septum. And this nasal septum basically divides the nasal cavity into two halves. So we have one nasal cavity over here on the right, and if I get the nasal septum out of the way, and this part here is the other part of the nasal cavity, or the left part of the nasal cavity. So if I get the nasal septum out of the way, what we see here, this is the lateral wall. This is the lateral wall of the nasal cavity. This is the floor of the nasal cavity. This is the roof of the nasal cavity. Okay, so let's look at the nasal cavity now. Now, nasal cavity, it's basically formed by three regions. One, when you stick your finger through your nostrils, your nares or external nasal aperture, okay, you stick it through here, and the lowest part of that area, this area here, is called the vestibulum or vestibular nasi, and vestibular naso. So this is the vestibular naso region or area, or regio vestibularis, and basically the most of the bulk of the nasal cavity is basically is called the respiratory region or respiratory area or regio respiratoria, and very small amount of area is occupied by what we call as the olfactory region or regio olfactoria. Now, the vestibular area, just above the nostrils, that is basically covered by skin. So therefore, the epithelium of this is stratified squamous epithelium, keratinized stratified squamous epithelium with coarse hair, thick hair, and these are called the vibraceae. Okay, and this vibraceae basically it holds dust particles in place, and there is an elevation of mucosa around about here, and this is called the Lehmann nazi. So Lehmann nazi, this elevation is basically demarcates the border between the vestibular area or vestibular region and the olfactory region. And this area is important. Why? Because this area is the epithelial transition occurs in this particular area. Why? Because the respiratory region or area is basically covered by the respiratory epithelium, and this respiratory epithelium is pseudostratified ciliated columnar epithelium with goblet cells. So we have a transition between stratified squamous to pseudostratified ciliated columnar epithelium, and this transition border is called the Lehmann nazi. And here is the olfactory region. Olfactory region is located. So this is the lateral wall, okay, of the nasal cavity, and at the roof of the nasal cavity, okay, above the superior concha. So we're going to look at this. This is superior concha. Above the superior concha, the roof of the nasal cavity. This is the olfactory region where you have. Okay, let's look at it. And so this is the olfactory region where you have these olfactory nerves, okay. And besides, in this olfactory epithelia, we have the olfactory nerves bipolar cells. Okay, let me just sit here. Okay, so so these are the olfactory cells. We also have the substanticular cells, supporting cells, and the basal cells. And these olfactory neurons, or bipolar neurons, so this is, we have the dendrites and the axons. The axons come together, and they penetrate through the foramina, the openings where you find these openings in the cribriform plate of ethmoid. So, for instance, let me show you this over here. I don't know if you can see it, but here are this is the cribriform plate of ethmoid. There's openings, little tiny little holes, and they are called the cribriform plate, okay? And foramina, where the olfactory nerves, so these nerves passes through these foramina and synapse with the second order neurons located in the olfactory bulb. This is the olfactory bulb. Now here we're in the anterocranial fossa in the brain area, in the cranium. Okay, so this is what cribriform plate of ethmoid. So many these olfactory phyla, what we call these filaments, they come together and they form the olfactory nerve. So olfactory nerve basically is very different than the other cranial nerves. Why? Because the other cranial nerve is only one. However, here each bundle of these filaments, they form the phyla. Okay, they call the phyla, and they are individually olfactory nerves itself. So there are many fibers which we regard. So functionally, it's one olfactory nerve, but structurally and anatomically, there is many bundles. Therefore, there's many olfactory nerves. And so clinically, this is important. So when you have a fracture of this area, so the since this is has close association with the anterocranial fossa and the brain area, and so if there's a damage in these areas, so you would have it would be susceptible to receive what we call as the meningitis or encephalitis. So there's a connection through these foramina from the nose to the anterocranial fossa. Or if there's a fracture of this cribriform plate, then since the brain is covered by the meninges, like in subarachnoid space, if the arachnoid matter dura is damaged, the subarachnoid means cerebrospinal fluid, there would be leakage of cerebrospinal fluid to the nasal cavity, and they will go out through the nostrils outside. So if there is a fracture, and if you have a leakage of fluid coming out from your nose, if it's clear, okay, and if it's white, so it's not blood, this would definitely come from after the injury, of course. This would be most probably would come from the subarachnoid space, which is the cerebrospinal fluid. So this is the olfactory mucosa. Okay, and so that's that. So, and the rest of the respiratory epithelium, as you can see, this is the respiratory epithelium, and the nostrils. So basically, this is the nostril here, and this is the anterior nasal aperture. Then we have the posterior nasal aperture. Posterior nasal aperture, which is this is on the posterior side here. Okay, and this is also referred to as what we call as the choana. Choana is singular, choani is plural. So the nasal cavity is continuous with the pharynx from the behind, and this area is basically called the nasopharynx. So pharynx, which is also called the throat, okay? So we have three parts. We have the nasopharynx, oropharynx, oropharynx, and laryngopharynx. And for example, I can show you that over here. So basically, this is the nares, the nostrils, the anterior nasal aperture. Here is the posterior nasal aperture, which is the choana. So basically, the nasal cavity continues, it passes through the choana, or choani, and enters the nasopharynx, the nasopharynx. Here, behind the ear is the oropharynx, behind the larynx is laryngopharynx, and therefore the air goes through the larynx. But if you eat a particle that goes through your mouth during swallowing, that food particle will go backwards to the esophagus. So pharynx basically carries both air and food particles. Okay, so like I said, so this area is the respiratory region, or area respiratoria, which is covered by pseudostratified ciliated columnar epithelium with goblet cells. The importance of this is that, like I said, it warms the inspired air. Why? Because in the mucosa it has a really dense and rich in submucosal venous plexus. So basically warms the air before it goes inside the lungs. The second, it filters. Okay, it filters, and this is because of the cilia. So the cilia that is present on the surface of the epithelial cells, they would contract backwards towards the pharynx. So the mucus secretion would trap these dust particles, and the cilia would move this mucus towards the pharynx, and we call this action as mucociliary clearance. So it clears, it basically cleans up and filters these dust particles. So that's the epithelia. And if you have a Carton-Agar syndrome, you would have a chronic sinusitis or chronic upper respiratory infection. If the cilia does not work, it basically will stay here, and it will cause more inflammation and irritation of the nasal cavity. So that's the mucosa of the respiratory region. So let's look at the walls of the nasal cavity now. Let's look at the walls. The walls basically is composed of the floor. Okay, so this is the floor of the nasal cavity. This is the roof of the nasal cavity. Roof. Again, this is the lateral wall. Okay, so and this is the lateral wall of the nasal cavity. And here is the medial wall. Okay, so the medial wall is basically formed by the nasal septum. Okay. All right. So I can show you this by looking at this model here. Okay, so this is the frontal section. Again, so this is the nasal cavity here, as you can see here. So this is the roof. This is the floor. Okay. This here is the lateral wall, and this is the medial wall. Okay, so medial wall is primarily formed by the septum. So we have one nasal cavity on the right, and then we have another nasal cavity on the left. Basically, the nasal septum divides the two nasal cavities from each other. This is the lateral wall. In the lateral wall, you have these concha, these shelf-like curved bony particles, which are called the concha turbinates. They form the lateral wall. This is the floor on the right, and the floor on the left, and then we have the roof, which corresponds to the upper part, which is the cribriform clava ethmoid here. Now, as you can see, the floor here, beneath the floor, you have the oral cavity. This is the tongue, okay, the frontal section of the tongue. So this here is the oral cavity, the teeth. Okay, this is the upper jaw, and here is the lower jaw, upper jaw, lower jaw. So this is the oral cavity, and this is the nasal cavity. As you can see, the floor on both sides separates the nasal cavity from oral cavity. So basically, the floor makes up the floor of the nasal cavity. However, at the same time, it makes the roof of the oral cavity. Okay, so let's look at that one by one now. All right, so we talked about the septum, right? We have the nasal septum. Okay, we have, this is the nasal septum. We have the septal cartilage on the anterior side. We have the posterior inferior would be formed by the vomer. Posterior superior is formed by the perpendicular clava ethmoid. So this forms the medial wall of the nasal septum. If we get the medial wall out, what we see here, again, the floor, the roof, and here is the lateral wall of the nasal cavity. Let's look at the floor. This is the floor. It also forms the roof of the oral cavity. This is the oral cavity. This is a soft palate here. And from here to here is basically the hard palate. Palatin drum is formed by the palatine process of maxilla and horizontal plate of palatine bone. So it's formed by two bones, maxillary bone and palatine bone. This is specifically speaking is the palatine process of maxilla, and this is the horizontal plate of palatine bone. So this is the floor. Okay, let's look at the roof now. Roof starts from somewhere around here and then goes all the way back here. So this is the lateral nasal cartilage. This is the nasal bone, okay. And then we see the frontal bone frontal bone, and this is the cribriform plate of ethmoid, and this is basically the body of the sphenoid. Okay, so let's do it again. Lateral cartilage, nasal bone, frontal bone, cribriform plate of ethmoid, and this is the sphenoid bone, or the body of the sphenoid bone, and we can see the sphenoid sinus here, by the way. So that's the roof. Okay, let's look at the lateral wall now. Lateral wall is formed by three tiny little shelf-like curved bony bones. We say bones. Okay. So we have three of them. We have this. The upper part is called the superior concha. The middle is middle concha. The inferior bone here is called the inferior concha. Now don't forget that superior concha and middle concha is part of ethmoid. Okay. So it's part of ethmoid bone. However, the inferior concha is a separate bone. All right. Now, and there is recesses, empty spaces between these concha, and these concha is also referred to as turbinates. Okay, so beneath the superior concha, superior turbinate, is the superior meatus. Beneath the middle concha or middle turbinate is the middle meatus, and below the inferior concha or inferior turbinate is the inferior meatus. These meati is it basically forms the track, the course, and the road for the traveling of the air through the nasal cavity and to the nasopharynx. Okay, so the air basically follows these roads, okay, backwards. And the other important thing about these meati is that the paranasal sinuses basically drain into these recesses or into these spaces. Okay, we're going to look at that a bit later. So that makes up the lateral wall. So this is the mucosa of the nasal cavity. If we get the mucosa out of the way, what we see here, okay, let's look at this part. We see the bony component. Okay, the bony component of the lateral wall. So this was the lateral wall. So these concha basically is present in the mid part of the nasal cavity. From anterior to posterior, what we see here is the other parts that make up the lateral wall. From anteriorly, as you can see here, this is the this is the maxillary bone here, maxillary bone. Just next to it is the lacrimal bone. So we're going from anterior to posterior. Maxillary bone, lacrimal bone, and then we have three conchas: superior concha, middle concha, inferior concha. Superior middle concha is part of ethmoid, inferior concha is a separate bone. If we go further backwards, we find this bone here, and this bone here is the perpendicular plate of palatine bone. So this is the palatine bone. Remember the other part of the palatine bone, so it's an L shape, as you can see. So the big part of the L is the perpendicular plate of palatine bone. It's the horizontal plate. So horizontal plate forms the floor, the posterior floor of the nasal cavity. The perpendicular plate palatine bone forms the lateral wall. If you go further backwards, you would find this bone here. This is the sphenoid bone, the body of the sphenoid. Here is the medial plate. This is the medial plate of pterygoid process of sphenoid bone. So these two make up the pterygoid process. We have the medial plate, lateral plate, and the medial plate forms the posterior lateral wall of the nasal cavity. Medial plate of pterygoid process of sphenoid bone. So this bony component basically forms the lateral wall of the nasal cavity. Okay. The other thing that we that we see in the lateral wall is these guys here, as you can see here. So I'm going to talk about the paranasal sinuses a bit later. But before that, what else do we see here in the lateral wall? We also see. Okay, so so this is the middle concha here. Okay, so this is the middle concha. If I resect the middle concha out, so what do we see beneath the concha? We see this bulging, protruding tissue, which we call as bulla ethmoidalis, ethmoidal bulla. And inside this bulla here, as you can see, these rounded empty spaces is the middle ethmoidal air cells. Okay, inside the bulla. And in front of the bulla, in front and inferior to the bulla, we see an opening here. This is the hiatus semilunaris, or semilunar hiatus. In front of that hiatus, we see a bony particle here, and this is the uncinate process, or processus uncinnatus. Is this bone here is part of ethmoid. Okay, this is hiatus. Hiatus is important, and a lot of drainage of the paranasal sinus basically open to this particular area. All right, so beneath the middle concha, when I take this out, we see this bulging tissue, which is called the bulla ethmoides. Inside the bulla, we find the middle ethmoidal air cells. In front and inferior to the bulla, we see an empty space, which is called the hiatus semilunaris, or semilunar hiatus. In front of hiatus, we see this bony particle, which is called the uncinate process. So hiatus is basically located between the uncinate process and the bulla. And hiatus semilunaris, or semilunar hiatus, is important where certain paranasal sinus basically drains into. Okay, so that's about it for that area. Now, okay, let's examine the paranasal sinuses. Let's examine the paranasal sinuses. Okay, so all right. So before that, I have to give you a small introduction. Okay, now let's look at the paranasal sinuses located in the head, in the facial area. So, the easy tips that we can memorize and learn the specific location of the paranasal sinus is the location of the sinuses in relation to the eyes. So this is the orbit, okay. And above the eyes, which is located somewhere around here, is the frontal sinus. All right. Below the eyes, which is located here in the maxillary bone, is the maxillary sinus. In between the eyes, located somewhere around here, is the ethmoidal sinus. And behind the eyes, which is located somewhere around here, is the sphenoid sinus. Okay. So let's look at the sinuses individually one by one. Basically, the sinuses, the reason why we have that is, so there's several functions of these paranasal sinuses. Is that one of the important functions is to basically reduce the weight. Because why? These are empty spaces inside the bones. So if you have empty spaces, that reduces the amount of weight of the skull. That's one. Second, it's also involved in producing the resonance of the voice. Just remember, if you have a sinusitis infection, then when you talk, okay, your speech basically changes. So it basically changes its resonance. And last is these paranasal sinuses, empty spaces, are basically covered by the respiratory epithelium, just like the nasal cavity, like certified ciliated columnar epithelium. And basically they do the similar function, just like the respiratory epithelium in the nasal cavity, like warming the air, humidifying the air, and filtrating the air. Okay, so these are the functions of these paranasal sinuses. So let's look at them one by one. So if I lift this up a little, so what we see here again in this model, so this is the lateral wall of the nasal cavity, all right, and this is the roof of the nasal cavity. Like I said, so this is the nose, okay, and you have the eyes over here. So behind, well, what did I say? Behind the eyes. So around about here, behind the eyes is the sphenoid sinus. This is a sphenoid sinus. It's an empty space here, okay, and the goblet cells that produce mucus, basically, or the fluid, drains through this ostium here. Okay, this ostium. This is the ostium of sphenoid sinus, and this ostium opens to this area here. This area is basically the corresponds to the roof of the nasal cavity, and superior to the superior concha. And this area is called the sphenoethmoidal recess. Okay, it's a dead end. It's like a pocket. So the sinus drains into the sphenoid sinus drains into the sphenoethmoidal recess. Okay, so basically this sinus is located in the corpus of the sphenoid bone, and above this sinus you have this structure here. It looks like a saddle, and that's why this is also referred to as sella turcica, the Turkish saddle, where the pituitary gland sits in this area. So the latest intervention technique that they use in brain surgery to take the tumor out of the pituitary gland, they use this road here. They go through the nostrils, okay, through the nasal cavity, and put a hole through the nasal sinus, and they approach to the pituitary gland or hypophyseal gland, and you just take the tumor out through this procedure. And this procedure is called the transnasal or transsphenoidal endoscopic hypophyseal technique or approach. Okay, so this is sphenoid sinus. The next sinus that we have here is located in this area here, and so this area is basically is between the eyes. So the eyes over here, one on the left, one on the right. So between the eyes we have the ethmoidal sinus. Ethmoidal sinus. Now, ethmoidal sinus is basically, I'm going to show you this in the cross section. It's much better over there. We have three ethmoidal air cells: anterior ethmoidal air cells, middle ethmoidal air cells, and the posterior ethmoidal air cells. Now, posterior ethmoidal air cells drains into the superior meatus beneath the superior concha. Now, middle ethmoidal air cells, like I said, if I get this middle concha out, so these are the middle ethmoidal air cells. Middle ethmoidal air cells are located inside the bulla ethmoidalis, and they basically drain to the surface of the bulla ethmoidalis. And from here, they just move on to the middle meatus. So, as the superior border of the bulla ethmoidalis, they go to the middle meatus. This is the middle meatus here. All right. So that's the middle ethmoidal air cells. And then we have the anterior ethmoidal air cells. Anterior ethmoidal cells drains into the anterior part of the hiatus semilunaris. They drain into the anterior part of the semilunar hiatus, the anterior ethmoidal air cells. Okay, so these are the ethmoidal sinus. Now we get to the frontal sinus. Frontal sinus is above the eyes. Okay, as you can see, this is the frontal sinus. It goes through the ostium. Okay, there's an ostium here, a hole, a foramina, and through the ostium it goes through a duct. That's the frontal duct or frontonasal duct. Frontonasal duct. Through the frontonasal duct, it opens to the area what we call as the infundibulum. So basically, the infundibulum is the initial part of the hiatus. It opens to the infundibulum, and from the infundibulum, it goes to the hiatus, and from the hiatus, it enters to the middle meatus ultimately. So the frontal sinus ultimately opens to the middle meatus. The last sinus that opens to the middle meatus is the maxillary sinus. Maxillary sinus somewhere around here, okay, through the duct of maxillary sinus and through the ostium, they open directly to the middle meatus. So there's four sinuses that opens to the middle meatus. There's middle ethmoidal air cells, anterior ethmoidal air cells, the frontal sinus, and then we have the maxillary sinus. Ultimately, they open to the middle meatus. Now, this is what opens to the inferior meatus. Inferior meatus, the nasolacrimal duct. Nasolacrimal duct basically carries the tears from the eyes. Okay, there's the holes like the punctum, and through that opens to the lacrimal sac. Lacrimal sac opens to the lacrimal duct, nasal lacrimal duct, and basically nasal lacrimal duct inside the bony component, and nasal lacrimal duct basically opens to the inferior meatus. Okay, so that's that. Let me show you the cross. Okay, let me show you this model here, and I'm going to go to the cross section after that. So this is the frontal section of the head, head region. These are the orbit. Okay, this is the eyeball. These are the muscles, and this is the nasal septum here, as you can see. All right, this is the medial border of the medial wall of the nasal cavity, and here is the concha. Okay, or turbinate lateral wall. This is the floor, and this is the roofs. This is the superior concha here. We have the middle concha, inferior concha. Superior meatus beneath the concha is the meati. This is the superior meatus, middle meatus, and then we have the inferior meatus. Okay. So beneath, in between the eye, so these compartments. And by the way, these are ethmoidal air cells. Air cells means compartments. It's not the same as the cells that we know in the tissues. Okay, these are not cells that we know. So these are basically compartments, and it might be 1, 2, 3, and basically these all compartments make up the cell. So you see, these are the ethmoidal air cells located in between the orbit. Here we see part of the frontal bone. So this is the frontal sinus on either side. Frontal sinus, ethmoidal air cells. And here, located inside the corpus of the maxilla, is the maxillary sinus, you see? Now, maxillary sinus is a little bit different in that all the sinus, except the maxillary sinus, basically they drain towards with the gravity. Therefore, the frontal sinus go down, the ethmoidal sinus also will go down, the sphenoid sinus will also go downwards. However, the maxillary sinus, as you can see, so when the fluid accumulates, it would accumulate first, and it has to go up. So the opening of the maxillary sinus is against the gravity. So we have the canal of the maxillary sinus, and we have the ostium, and that ostium opens to the posterior part of the hiatus semilunaris and to the middle meatus. So therefore, the time that stays in this sinus, the secretion stays here for a long time, and during this condition or position or stay in this area creates inflammation or might produce infection. So most of the infection occurs in the maxillary sinus because of this anatomical position of the maxillary sinus. And it's one of the biggest sinuses compared to the other sinuses. And that's about it. Okay, so to look at the ethmoidal air cells and sphenoid and the maxillary sinus, I'm going to show you on the in the cross section the axial or the horizontal or transverse section of the head region. Okay, let's look at it right now. Okay, so this is this area. So this is the orbit, the eyeballs. Like I said, in between the orbit is the ethmoidal sinus. And in the ethmoidal sinus, as you can see, we would see from anterior to posterior, we have many compartments, and we call these compartments as cells. And we divide this into 3 groups. Most anteriorly located is the anterior ethmoidal air cells. This is on the left, and then we have the same on the right. Anterior ethmoidal air cells, middle ethmoidal air cells, and the ones located in the posterior aspect is the posterior ethmoidal air cells, or cellular ethmoidalis, posterior cellular ethmoidalis media, and cellular ethmoidalis anterior. And as you can see, behind the ethmoidal air cells, on the left and the right, we see the sphenoid sinus. So this is sphenoid sinus at the back here. So, so clinically, what's the importance of these? So if you have a ethmoidal air cell, ethmoidal sinusitis, so there are certain places that would affect. So the infection would spread to the neighboring structure. So which areas do we see very close to the ethmoidal sinus. One, it's very close to the orbit. Okay, this is the orbit, the eyeball. All right. In the mid part of the ethmoidal air cells, it's very close to the optic canal, and also the posterior ethmoidal air. So the middle and posterior ethmoidal air are very close to the optic canal here. All right. So if you have a chronic ethmoidal sinusitis, it might spread to the orbit, affecting the eyeball, there's a lot of nerves here, vasculature here. It would affect the eye, okay, and somehow it would damage the, it would decrease the functions of the eyeball, okay. It would affect negatively of the eyeball and its content. And the middle ethmoidal and posterior ethmoidal air cells would affect the optic canal and optic nerve. So this is the optic nerve that basically receives information from the retina, and we're talking about sight. So this would affect the vision of that particular patient. All right. So that's that. So this is the clinical information regarding the ethmoidal air cells. If I go down a little bit more, okay, so if I go down, so what we see, so this is the upper part of the, this is the upper section, okay, so it's like at the level of the eye, all right, level of the eye. So we have ethmoidal sinus on the left and then on the right. In between, we have the septum. So this is the septum, and the septum is basically composed of the perpendicular plate of ethmoid. Okay, so we have the perpendicular plate of ethmoid at the top here. Again, we have the similar section. Again, the ethmoidal air cells on the right and left, and we have the perpendicular ethmoid, and here is the nasal cavity here. Okay, so when we get to this area, so we're going down now. We're going down, 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 and we're basically coming up with the maxillary sinus now. Okay, so these are the maxillary sinus. Okay, it's just beginning of the maxillary sinus. It's the beginning of the maxillary sinus. Here we start seeing, so this is the nasal septum. At the front is the cartilage. This is the septal cartilage, as you can see here. Okay, and again, this is the perpendicular plate of ethmoid still. If we go down a little bit more, we can see the maxillary sinus more accurately here. So this is the lowest part. The lowest part, which is this area here. Again, we see the septum, the septal cartilage. But this bone here, since we're at the lower level, this bone here is the vomer. So the upper level of the bony component is the perpendicular plate. The lower level is the vomer with the septal cartilage. One thing I want to show you here is the maxillary sinus, as you can see here. Now, maxillary sinus, somewhere around at this area, it opens to the middle meatus. Okay, so it's not really apparent, but so it opens to the middle meatus, where the canal and opening of the maxillary sinus to the middle meatus, there's a cell that is called the Haller cell. So Haller cell is located. Haller cell is located where the ostium of the maxillary sinus opening to the middle meatus. Haller cell. Clinically, this is also important when there's a hypertrophy or irritation or inflammation, and when there's swelling of this Haller cell, basically it compresses on this duct, the duct of the maxillary sinus, and the ostium, it compresses that, and so it does not allow, it prevents the drainage of the maxillary sinus, producing the maxillary sinusitis. And we also see that in the frontal sinus. We also see that in the, let me show you on this model here, which is not really apparent, but so this is the frontal sinus here, as you can see. So we have the nasofrontal duct, okay, and then it opens to the infundibulum, all right. So at this area, just beneath the frontal sinus, we have agar cells. So agar cells does the same thing. So when it swells, it compresses on this duct and ostium of the frontal sinus. so preventing the drainage of the secretions of the frontal sinus. Therefore, it prevents the drainage, so it accumulates here, and it produces the sinusitis, and this is basically a chronic frontal sinus. It occurs, so so the frontal sinusitis may occur with the compression of the swelling of the agar cell. So agar cell primarily affects negatively to the frontal sinus drainage, and then we have hilar cell. And then we have the hilar cell is located where the opening of the maxillary sinus, the ostium of the maxillary sinus, into the middle meatus. When that swells, and then it blocks the. So we have two clinically important cells: the hilar cells and the agar cells. Okay, so basically, this is it about the paranasal sinuses. I think we covered a lot, both functional and clinical aspect of the paranasal sinuses. Hope you enjoyed it. Okay, and good luck in your exam. And in our next video, we're going to look at the in the wet specimen and the cadavera of all the things that we saw here. And hope you liked it. Okay, thank you very much for listening. Bye bye.